Welcome to COVID Conversations, a group of videos and documents intended to guide you during these uncertain times. This video will provide you with the tools to discuss and understand the differences between quarantine and isolation. This video and the accompanying documents were produced by the Central Shenandoah Health District. This is an outline of the presentation. We will first define some terms that have been used throughout the pandemic. Then we will talk about quarantine and different quarantine scenarios. Then we will talk about isolation, and we will finish off by talking about considerations for your students. Before we talk specifically about quarantine and isolation, it is important to define some terms that have been used throughout the pandemic. Many of these terms have been used interchangeably, but there are key distinctions between them. First, we have staying home, and this is what we've been doing since the beginning of the pandemic. We've been limiting our activities outside our homes, making essential trips to get food and medications, going to work, and doing socially distant outdoor activities. Staying home helps limit opportunities to come in contact with contaminated surfaces and infected people. When we do leave our homes, we've been practicing social distancing or physical distancing. This means keeping 6 feet between you and others and not gathering in large groups. This is practiced alongside other preventative actions, including wearing masks, washing hands, and cleaning and disinfecting high-touch surfaces. Like staying home, social distancing helps limit opportunities to come in contact with contaminated surfaces and infected people outside the home. Next, we have quarantine, which is also referred to as self-quarantine. And this means that you need to stay home if you have been exposed to someone who has COVID-19. Quarantine helps prevent the spread of disease that can occur before a person knows they are sick or if they are infected with the virus without feeling any symptoms. And then lastly, we have isolation. And isolation means that you have COVID-19 and need to stay away from others, even those in your household. Isolation helps prevent the spread of disease by limiting the contact an infected individual has with others. Next, we're going to talk about who needs to quarantine. So you should quarantine if you have been in close contact with someone who has COVID-19. Close contact means you are within 6 feet of someone who has COVID-19 for a total of 15 minutes or more. You provided care at home for someone who is sick with COVID-19. You had direct physical contact with the person, so you hugged them or kissed them. You shared eating or drinking utensils. They sneezed, coughed, or somehow got their respiratory droplets on you. If you determine you are a close contact, or a contact tracer calls you to let you know that you are a close contact, you will need to quarantine. Quarantine means that you need to stay home for 14 days after your last contact with a person who has COVID-19. So you shouldn't go to work or take public transportation or anything like that. You should monitor your symptoms, so watch for a fever above 100.4 degrees Fahrenheit, a cough, shortness of breath, or other symptoms of COVID-19. And then if possible, you should stay away from others, especially those who are at higher risk. Next, we're going to talk about a few quarantine scenarios. So in this scenario, you had close contact with someone who has COVID-19 and you'll have no further contact. So this means you should stay home for 14 days and monitor your symptoms. Your last day of quarantine is 14 days from the date you last had contact with the infected individual. So in this graph, the red circle is your last date of contact, and then 14 days from then, which is represented by the green circle, is your last day of quarantine. All right, in this next scenario, you had close contact with someone who has COVID-19, you live with them, but you can avoid further close contact. So this is the same as before. Your last day of quarantine is 14 days from when the person with COVID-19 began home isolation. So the person with COVID-19 started home isolation on the first, the red circle. You had no further contact with them, so your last day of isolation is 14 days from then. It's represented by that green circle. All right, next, you had close contact with someone who has COVID-19, you live with them, and then you had additional close contact with them. So, if you are under quarantine and have additional close contact with the infected individual, you will need to restart the 14-day quarantine. Anytime a new household member gets sick with COVID-19 and you had close contact, you will need to restart the quarantine. So on this graph, you started your quarantine on the 1st, and then you're quarantining, and then on the 5th, you had contact with the same person who has COVID-19, or maybe someone else in your household got sick. So that means you have to restart the 14 days. So 14 days from the 5th, which is the 19th, that green circle, would be your last day of quarantine. All right. In this last scenario, you had close contact with someone who has COVID-19, you live with them, and you cannot avoid additional contact with them. So, if you live with someone and cannot avoid continued close contact, like you're providing care or you're sharing a bedroom, living in close quarters, or something like that, your 14-day quarantine begins after the person with COVID-19 meets the criteria to end home isolation. And we'll discuss that criteria when we talk about isolation. So if you look at the graph, we have a person who is sick with COVID-19. They start their isolation on the 30th, and it goes through the 9th. And then that is when you would begin your quarantine, and you would quarantine for 14 days. So that would be to the green circle, or the 23rd. All right, we're now going to talk about isolation. So those who need to isolate are people who have tested positive for COVID-19 and have symptoms of COVID-19 and can recover at home. Those who have tested positive for COVID-19 but have no symptoms, they're asymptomatic, or people who have been asked to isolate by public health officials. So maybe you are a presumed positive case. So the key part of isolation is separating yourself entirely from others in your home. So you need to stay home except to get medical care. And if you do need to seek medical care, call ahead and let them know you have COVID-19. Continue to monitor your symptoms, stay in a separate room from other household members if possible, use a separate bathroom if possible, and then avoid contact with other members of the household, including pets. Do not share household items like cups, towels, utensils, and if you do have to be around other people, wear a mask. So there are two scenarios for ending home isolation. So the first one is you think or you tested positive for COVID-19 and you had symptoms. So at least 10 days have passed since your symptoms